Hi everyone. In today's tutorial, we'll be talking about the Circle of Willis or the Circulus arteriosus. Now, this is a very important arterial interconnection because aneurysms of this area can be very, very fatal. Now, we would look at the Circle of Willis, as you can see from the diagram, is found in the interpendicular fossa. This region is called the interpendicular fossa. So this is a cadaveric image at the base of the brain. This is the interpendicular fossa. You can see the optic bulb here coming down. You can see the optic nerve. Now this is the chiasma, which has been cut. This is the optic chiasma. This is the infundibulum. This is the tuber cinereum. This is the posterior perforating substance. So the circle of Willis is found within this specific region of the brain called the interpendicular fossa. Now, we'll talk about the site of the Circle of Willis. We'll talk about the formation of the Circle of Willis, and we'll talk about the clinical correlates or the clinical importance of the Circle of Willis. Now, the site of the Circle of Willis, we said that the Circle of Willis is found at the base of the brain, specifically at the interpendicular fossa, this region, interpendicular fossa. So this is the optic chiasma. Now, for the formation of the Circle of Willis, it's important to note that the Circle of Willis is formed by two main arterial systems. The vertebrobasilar artery system and the internal carotid artery system. So the vertebrobasilar artery system, which means that it's formed by the vertebral artery and the basilar artery. So vertebrobasilar artery. So you can see the two vertebral arteries down here. There's one, there's two. The two vertebral arteries come together to form the basilar artery. Basilar artery, because it's lying on a basilar groove found in the region of the pons. So this is the basilar artery. Okay, so this is the vertebrobasilar artery system, because the branches of the basilar artery forms part of the Circle of Willis. The other system that forms the Circle of Willis is the internal carotid artery system, whose branches gives off the anterior cerebral artery on one side and anterior cerebral artery on the other side, which forms the anterior part of the Circle of Willis. So the branches of the basilar artery forms the posterior aspect of the Circle of Willis. So you can see this is the basilar artery, this is the posterior cerebral artery, this is the posterior communicating artery, which is joining the internal carotid artery. And you can see the branches of the internal carotid artery, which is the anterior cerebral artery, this one, anterior cerebral artery, and the other one, anterior cerebral artery. And the two anterior cerebral arteries are joined by the anterior communicating artery. Now you can see that there's another branch of the internal carotid artery, which is the middle cerebral artery. Now this artery is not considered to be part of the Circle of Willis. It's actually outside the Circle of Willis. This artery, the middle cerebral artery, is outside the Circle of Willis. So basically, that is the formation of the Circle of Willis. Again, the Circle of Willis is formed by two main arterial systems, the vertebrobasilar artery system. It's made up of the vertebral artery, the two vertebral arteries coming together to form the basilar artery, and then the internal carotid artery system. Okay, we said that the vertebrobasilar artery system, the branches of the basilar artery are the posterior cerebral arteries, which forms the posterior aspect of the Circle of Willis. And then the branches of the internal carotid artery, which is the anterior cerebral artery, which forms the anterior aspect of the Circle of Willis. Now, for the clinical importance, number one, you have to know that the Circle of Willis is formed by two arterial systems, vertebrobasilar artery and the internal carotid artery system. That's the first thing you should know. The second thing you should know is that the artery is joined on each side by the anterior communicating artery and the posterior cerebral artery. Now, the other thing is that there is no mixing of blood within this arterial anastomosis, this arterial system. There's no mixing of blood. And the reason is very simple. The reason is that the pressures within one side of the arterial system and the other side of the arterial system is equal. So anatomically or physiologically, this Circle of Willis is considered not to be functional. It's only functional when there's a blockage in one part of the arterial system. So for instance, if there's a blockage in the anterior cerebral artery, that is when the other part begins to function to supply blood to the affected side. Now, the Circle of Willis tends to supply blood to the ipsilateral half of the body. That's another clinical importance. So again, we'll go over the clinical importance. We said that it's formed by the two arterial system, the vertebral-basilar artery system and then internal carotid artery system. We said that the branches of the basilar artery forms the posterior cerebral artery, Then we have the posterior communicating artery coming off the posterior cerebral artery to join the internal carotid artery. And we said that the anterior cerebral artery is a branch of the internal carotid artery, and the two anterior cerebral arteries are joined by the anterior communicating artery. We said that functionally, the Circle of Willis is not functional physiologically. It's not working because the pressures are the same. So there's no mixing of blood from one side to the other side, except when there's an occlusion in one part of the arterial system. That's when you have the other part functioning. Okay, so to reiterate what we've discussed, so this is the vertebral artery, this is the vertebral artery bifurcating, this is the vertebral artery coming together to form the basilar artery. Now the basilar artery will bifurcate into this is the posterior cerebral artery, This is the posterior communicating artery joining the internal carotid artery. This is the other posterior communicating artery joining the internal carotid artery. We said this is the middle cerebral artery, which is not part of the Circle of Willis. This is a branch of the internal carotid artery. And we said another branch of the internal carotid artery, which forms the anterior aspect of the Circle of Willis, is the anterior cerebral artery. So this one, anterior cerebral artery, and we have another anterior cerebral artery. And these two arteries are joined by the anterior communicating artery. Now, there are other branches that we need to look at. So you can see that this is the two vertebral arteries, this one and this one, the two vertebral arteries. Now, this branch coming off the vertebral artery is called the anterior spinal artery, which supplies the anterior 2/3 of the spinal cord, anterior spinal artery. This is the posterior inferior cerebellar artery. This is the pica. Usually, the posterior spinal artery comes off the pica. That's the posterior inferior cerebellar artery. Now, we need to look at some of the branches of the basilar artery. So this is the anterior inferior cerebellar artery. This is the pontine artery. This is the labyrinthine artery. This is the superior cerebellar artery. And then we have our first branch, which forms the Circle of Willis. That's the posterior cerebral artery. Again, you can see the two arterial system, the vertebral-basilar artery system, and the internal carotid artery system. So this is the vertebral-basilar artery system connected to the internal carotid artery system via the posterior communicating artery. So on the left and the right side, you can see that the connection is via the anterior communicating artery. So the right is connected to the left via the anterior communicating artery. Now, clinically, it forms a collateral circulation in case of an obstruction of any of the arteries. And normally, there's no mixing of blood that occurs even in the basilar artery. There's no mixing of blood in the basilar artery. There's no mixing of blood in the posterior communicating artery. There's no mixing of blood in the anterior communicating artery. Again, there's no mixing of blood in the basilar artery, no mixing of blood in the posterior communicating artery, no mixing of blood in the anterior communicating artery. And this is simply because blood pressure is equal in the artery when it comes to the Circle of Willis. Now, as you can see here, this is the brain, this is the base of the brain, this is the interpendicular fossa, where we said that we can find the Circle of Willis. Now, one of the clinical importance of this circle is that most of the cerebral aneurysm occurs within this area, and specifically for the Circle of Willis, aneurysms occur in the anterior communicating artery. This is a berry aneurysm. So aneurysm is simply a dilatation of the arterial wall due to weakness in the muscle layer. So you can see an out portion of this arterial wall. So this is the anterior communicating artery where usually within the circle of Willis, you have aneurysms occurring. Now, once this aneurysm ruptures, you can have what we call subarachnoid hemorrhage. And this hemorrhage can concomitantly cause, in severe cases, cause hydrocephalus, because the blood is going to coat on the arachnoid villi, which would prevent the absorption of CSF into circulation. Okay, so let's identify these arteries. Okay, we'll start from one. We know that one is the anterior cerebral artery. We know that two is the anterior communicating artery. We know that three is the middle cerebral artery. We said that it's outside the circle of Willis, so it's not part of the circle of Willis. Four is the internal carotid artery, which is one of the main arterial systems. We know that five is the posterior communicating artery. We know that six is the posterior cerebral artery. We know that this is a branch of the basilar artery. It's called the superior cerebellar artery. Eight, obviously, is the basilar artery. And then 9 is the vertebral artery, and 10 is the anterior spinal artery. We said that it supplies anterior 2/3 of the spinal cord. Thank you very much for your time, and I'll see you in the next video. Kindly like, share, and subscribe to my YouTube channel. Thank you.